Hello, this is just a, a more detailed version of what happened, of the actual situation. I wasn't clear at all why I made that video. That video was mainly for context, I guess. So, here's what happened. I went to the ER at 8:50 p.m. on on 09/08/19. And when I got there, I waited, I believe, an hour to a half hour before I went into triage, which is where they take your initial vitals and stuff like that to see if you're hemodynamically stable, to whether they need to admit you immediately, and so on and so forth. It's the only way to get past this point is if you're passed out, pretty much, or you're bleeding substantially. That's pretty much it. So I went to this, and the main problem is this. So I went to triage, and I was given an EKG because I was complaining about palpitations, chest pain, shortness of breath. I could go on forever. Not even forever, just headache, dizziness, blah, blah, blah. Typical heart failure shit. So I go and I get my EKG, and it comes back abnormal. Came back abnormal. The machine said it was abnormal. It said I had ST elevation, and pericarditis or something like that, which is similar to myocarditis, except that this is pericarditis is inflammation of the pericardium sac, which is the sac that surrounds your heart to keep it in place and stuff like that. I don't know anything about the pericardium sac, but this is pretty fucking bad, and it explains a lot of my symptoms. One of the main symptoms it explains is the pain I feel in the veins in my neck, because usually you only have that symptom if you have something called cardiac tamponade. Ooh, I'm saying that weird. Tamponade, not the food, tamponade, or something like that. But that's pretty much when there is too much fluid between the heart, your actual heart, and the pericardium sac, and it causes too much pressure on the heart, and the heart can't properly retract, or it can't properly expand. So it causes problems, and it can cause neck pain because your vessels are. Yeah, I'm not a doctor, so that's, yeah. So that happens. So it explains that because inflammation, something gets inflamed, it gets swollen. It gets swollen, it gets bigger. Basic stuff, I think. So it explains one of those symptoms, and a symptom I literally have fucking right now. It explains a lot of things, but I don't think this is the root cause, because pericarditis can be caused by a serious infection, which is actually possible. It could have some fucking virus or something stupid like that. So I'm gonna infect you all. No, I'm just kidding. That's, or I had a heart attack, and pericarditis is as a result of it, which is an actual thing for it, believe it or not. But pericarditis is actually kind of hard to pinpoint why it's even caused, so I will mention that as well. Okay, so anyways, back to the thing. This is what that EKG said. What the fuck is my pointer at? What? Oh, oops. So, yeah, my EKG said this. ST elevation, which is bad. It's indicative of a heart attack, or a stimulant, or I don't. Like I said, I'm not a doctor. I try not to research this because I'm always being told not to. You know, I'm trying not to think about it myself. Pericarditis, which is bad, and two other things that were wrong with my I'm not even gonna look, but 2 other things that were also bad with one of my EKG leads. So yeah, I got an abnormal EKG. You would think, oh, hey, Reddit user, you might not be crazy after all. There may be something actually wrong with your heart or your body if you have an abnormal EKG in your incredibly early 20s and you have a bunch of symptoms and you look like shit, your hair's fucking falling out, you fucking can't sleep too much anymore, you can't eat, you're losing weight like your weight's dropping like a fucking bowling wall. I forgot the actual. Hold on. I forgot the actual expression. But yeah, you think maybe they do something for you. Maybe you can get a medication. Maybe they'll do a special test to help you figure out what's going on. But nope. After I received this abnormal, which means not normal EKG, I got sent back to the lobby to wait an hour or more before I even got a bed. And when I got that bed, I wasn't hooked up. My heart rhythm was not hooked up to the monitor. I wasn't hooked up to the blood pressure monitor. I was only hooked up to a pulse ox. I was only hooked up for my oxygen and my heart rate. That's it. My oxygen saturation given in percentage of oxygen in your blood. Oh, I said that weird. That's it. And I was sitting there like that from around 11, maybe 12, to 2 a.m. in the morning. In pain, and my heart and my everything wasn't normal. My blood pressure was coming back hypotensive. I think, but I know this for a fact. My heart rate, because I think I got it on video too. My heart rate was below 50 at more than a few points, and it was just when I was on Reddit making a meme or just on Reddit just chilling. I wasn't paying attention to anything like everyone always tells me to do. Like, oh, just forget about it. Don't even think about it. I'm like, all right, cool. And I'm just sitting there, and all of a sudden the machine starts beeping like crazy, and I'm like, now the fuck what? And I look, my heart rate's below 50. The normal for an inactive male who has, but who's not fucking physically active because they can't be, is around 60 beats per minute. Oops, BPM, sorry. Not below 50. I mean, not below 60. You get what I'm saying? So mine was around 40 something in a sitting upright position, doing something on a tablet, kind of moving a bit. Which is all bad. Like, all bad. Considering I have shortness of breath, chest pain, overall feeling of unwellness. So the problem is, I got sent home with no medicine, nothing, just a diagnosis of being a hypochondriac and just overthinking and being a fucking idiot. So I was like, alright, whatever. So today I had a doctor's appointment and I requested that they looked at the EKG and tell me what they thought. They couldn't get a hold of it. All they can get a hold of was the doctor's notes. Oh, here we are. Oh, the doctor's notes, which I have in my hand. Let me get to that. So they can only get a hold of the doctor's notes. The doctor noted there was no ST elevation. Nothing was wrong with it. Even though I literally saw the piece of paper that he printed and ripped off, and I literally saw the machine, they both said pericarditis, ST elevation, and a few other things were wrong with it. Very abnormal. And my heart rate was fucking low. It was 70. It was 70. It literally said 70. Which means it wasn't anxiety. It wasn't my mind fucking with my heart rate rhythm. Heart shit, you know what I'm saying? It wasn't anxiety. So yeah. What she told me was, she read it off the thing, she said, I had normal sinus rhythm with a ventricular rate of It's not even in my fucking. He didn't note it down. He said normal axis, normal intervals, no ectopy, no ischemia, which is no sign of lack of oxygen to my heart tissue, and the fucking lie, no acute ST or T wave changes. When the EKG specifically said ST elevation, it was pretty fucking apparent, and the machine was pretty adamant of being like, yo, he has ST elevation. So anyways, the point of this video is that I went home. I got home from the doctor's visit. I was fucking mad because, like I said in my other video, she told me she was never gonna do tests for me again. She doesn't want me to go. She doesn't want me to make an appointment with her when I have palpitations. She wants me to go to my cardiologist. She abandoned me pretty much. And I'm not gonna change my fucking doctor again because I don't want to have to go through the fucking process. Because I thought she was actually gonna help me, but no. So the problem is, I went home. I was fucking mad, but I was like, instead of freaking out, I'm gonna go get a copy for myself of my EKG from this date 09 08. 0909. Sorry, I confused everybody. Oops. If anyone's even watching this. 09 08 19 to 09 09 19. I wanted this fucking EKG. The one that had the pericarditis ST elevation. My last ER visit at that hospital. So I went and I was like, yo, I called and I was like, can I pick it up? They're like, sure. You guys already know this. So pretty much, they gave me the wrong ones. They gave me the date from a few days prior that I went. And I was like, can you guys please give me the right ones? And they tried looking for it and it's not there. It's gone. It doesn't exist. They're only going off of the doctor's notes. The doctor's notes saying my EKG was perfect. They're pretty much full of shit. You know? They couldn't find it anywhere. It's not even in my hard copy. It's the actual thing, the one that I had and the one that the nurse had, that he ripped off from the machine, isn't even in my folder. It's nowhere. It's not in the ER. It's nowhere. They looked. They checked. It's gone. I think I brought up the nursing supervisor that was talking to me. Dude was a total douchebag. And when I first arrived, he walked in and he started like circling me, like straight up like walking like inches from my chair for no fucking. The room was empty. There's no one to look for. And it's like mad dogging me, looking me around. But I was like, I'm here for my copy. I ain't here to throw down with your fucking bitch ass. You know what I'm saying? Like fucking. I'm just here for my EKG. That's all I want, and I want that, and I want to leave. I don't want no fucking problems. So I had to deal with that douchebag. He was like, no. He's like, if the doctor's notes say you're fine, you're fine. And I was like, fuck you. I was like, fuck you. So anyways, it makes no sense because they gave me an old EKG, which they found right off the bat, but they couldn't find me an EKG that I literally just got a fucking few days ago. Not even the actual fucking hard copy. This is proof that I was right all along. My tests are being tampered with. And they're fucking and they're intentionally misdiagnosing me. They're actually forming malpractice. It's all fucking true. And sure, this is like, oh, maybe they can't find it. No, they couldn't find anything. They looked, and I was there for fucking 2 hours. And the hospital's always pretty much empty because it's like the worst hospital you can fucking go to. So it's true. I'm not in one big delusion. They are actually fucking with my test. And if anyone wants to investigate this, like I said, look for the EKG on these dates. I can die before I reach my cardiology appointment in 8 days. Everyone's fucking abandoning me. My doctor abandoned me. Everyone. And now that my EKGs are coming up abnormal, my second one, with no electrolyte deficiency, I'm done for, So yeah, anyways, this is it. Bye.